Okay, here we go. So, welcome everybody. Good afternoon from Ottawa. It's a nice sunny afternoon. Families Canada launched these discussion forums in response to the COVID-19 pandemic because we wanted to offer a platform that allows Canada's family support sector to connect, to share concerns, and of course to learn from each other. Today's topic is something top of mind for family support practitioners and those of you who are busy supporting all types of families with all types of issues will certainly want to hear what our guests have to say. Our guest speakers are going to elaborate on how their family support centers are adapting their means of supporting families during COVID-19. So joining us today, we have Sharon Feldman, who is the supervisor of the Family Resource Center of Jewish Family Child Service of Greater Toronto. And Sharon is a parenting consultant with over 30 years experience supporting young families. She offers home visiting interventions, specializing in families that are with children who are 0 to 3 to improve maternal mental health and parent-child engagement, as well as positive discipline. And we have Julio Bello, who is the executive director of South Vancouver Family Place, and he joined that organization just last July. Julio manages 3 locations in Vancouver, Fraserlands, South Van Family Place, and Kids Care, and he does this with the help of 20 staff, all of whom are licensed ECE workers, and 2 of them are master's level counselors. So Sharon, why don't you get us started by describing your experience and how Toronto's Jewish Family and Child Service is adapting its approach to helping families just now.
Great, thank you so much. So we were directed to close our center on March 15th, and we closed to the public, but we stayed in our center that week and just waited for further direction. I had all of my part-time staff were laid off, and our volunteer program was closed. So we went from being a team of 7 to a team of 3. And we run 4 programs out of our Family Resource Center. We run a homework club that is designed for students middle school and high school that's run by volunteers. The facilitators are all volunteers. And we had 1 part-time staff who was overseeing that program. We run a clothing cupboard for women in transition or women in distress who are in need of clothing or essentials for themselves or their children. I had a part-time staff who was running that program. We run a conversation cafe, which is an English program for newcomers to strengthen their social skills and their conversational skills, facilitated entirely by a team of volunteers. And then we have our family drop-in, which is our largest program. And I have 2 full-time staff for that program, in addition to part-time staff and volunteers. So because the volunteer program closed and all of the part-time staff were laid off, and we transitioned to home, my full-time staff and myself, the 3 of us. We put a work plan together to see how to support our largest program, which is our family drop-in. And we're lucky that we have a Facebook page that was already in use, but we had been using it primarily just for announcements and events that might be happening. And so we knew that we had to start providing some Zoom programs and gatherings and get-togethers, and using Facebook more as a platform to engage with our population of families. From my end of it, the first course of action I realized early on was training, tech training for my team, because the 2 full-time staff who had been working in the family drop-in for 10 to 15 years. These are direct service people who are frontline people. They're not used to doing things over Zoom. They're not used to interacting that way digitally. So it took time to bring them up to speed and train them on just the platform itself, how to use the tech, and then the skill set of having to run an interactive circle over Zoom also took some time. But they really stepped up, and I have to commend them. The 2 staff that I have, they're not native Canadians. English isn't their first language. So many personal struggles for them. They have children at home now, And yet we've managed to build up to offering a daily circle every morning, which is what we were doing in our center. So we have that Monday through Friday, and we have between 30 and 50 families that will log in for our morning circles, and they're going extremely well, very interactive. What I've been doing is using our Facebook page, and I'll post a question in the morning. So in order to gain access to the circle, you have to participate on Facebook, answer the question, and then I bring that question back into the beginning of our circle to do some announcements there. So, you know, and I've taken the opportunity, and it's interesting, you know, there's been the positives that have come through this COVID experience, so many things that I wanted to do with my team that we'd never had time to do, and even with the families. So now I have this moment where I can speak to the families that are on our Zoom call about things like cognitive flexibility. And I brought that into our question one morning, you know, how have you had to be flexible during this time? That was one of the questions. And so parents were answering in all of their honest ways about how, you know, the ways that they've had to shift gears during these last number of weeks. And it was great for me to have that opportunity to highlight for them and have parents be reflective about that. And then I would bring it back into our circle and talk about that for a few minutes before we actually went on to stories and songs and rhymes. So that's going very well. We're about to build in some afternoon parent cafe type drop-in for the families that are missing that component of just socializing with one another. So that's next on the list. We've been working on ways to engage with the seniors in our program. So we have a cohort of seniors who are actually our volunteers. And then we have seniors that we support through our Conversation Cafe, as well as the intergenerational program. So we just launched an initiative, a kindness kit initiative, where children and families and volunteers are writing letters and making cards from home and drawing pictures, and they're going to be dropping it off. Tomorrow, actually, I'm going to go to our center in the parking lot and just set up a basket and stand a social distance away. And families have been writing me to say that they're just so grateful to have something to do, that they're happy that they have a direction. I myself have been part of a club that actually writes cards for elderly seniors that are lonely. And it's kind of a global initiative. These are not people I would ever meet. I don't know where they live, but I've been part of it because I'm a crafter and I like to make cards. So it was something that came naturally to me to say, we want our kids to be engaged in something creative. We need to have an outlet for parent and child to have that connection. And wouldn't it be great to uplift our seniors at the same time in a way that maintains confidentiality, but also kind of helps everybody interact. So we're looking for ways to integrate our programs and integrate the way that we're connecting with one another and within our programs. So that's kind of exciting as well. Yeah, I think that's I've been really moved by a lot of the ways that my team has managed to stay together. So like I said, we had part-time staff that were let go, but we had initiated, when I came on board 3 years ago, I initiated a weekly lunch with my team because everybody was so staggered. I picked the one time during the middle of the week that a few of us were really there, and we do this social lunch. And over the years, staff that weren't even on a shift would come to have lunch because we all live fairly close to the center. And my part-time staff has been let go, but they've wanted to have lunches every week. So we've had Zoom lunches where we've all gotten together, and they're really feeling like they're still connected to the center. I think that more than, for all of us, right, more than anything, we've wanted to make sure that staff, volunteer, family, senior, however way you've been supported by our center, you still feel like you're top of mind. And whether the center is open or closed, or whether you are still employed by us or not, you're still part of the family. So that's essentially where we're at.
Well, it's pretty interesting. Thanks, thanks, Sharon. I think the notion of getting creative in how we digitally connect digitally, connect. You know, so many of us were wondering how that would actually work, and here we are, dropped right in the middle of it and pushing our own envelope and keeping teams and our own staff teams, even your volunteers and your part-timers who've been laid off, and families together, and the sort of the license to experiment and things that we might have even been thinking about in the past but didn't know how on earth we would ever fit into our usual programming. Suddenly there's the opportunity for better or worse, and sounds like you're really just going for it. And I was also interested in how you are connecting children and seniors together, which is something that Families Canada is deeply, deeply interested in. So thank you so much. And with that, I'm going to turn it over to Julio.
Hello, everyone. I was muted. Wow, Sharon, you've done so much. It's very impressive, the work that you've done, and I'm not sure if I can match that. So what I'm really impressed with, and maybe I'll start with a sidebar, because we're heading towards the tail end of this pandemic, and we're already starting to think about how are we going to open our center. Our province is looking at relaxing some of its restrictions. So we're sort of heading towards the tail end of it now. And the meetings that I've been having with EDs, we've all had said the same thing, as you pointed out, Sharon, is the amount of creativity that has taken place has been outstanding from all staffing capacity. And it's interesting how us as leaders, you know, there's what we've done here is we really sort of let the staff figure this out too, to take that ownership, and what's happened through that piece is that they've taken ownership of some of the projects and they've run with it, and they've done such a great job. And us as well, we have some workers who English is not their first language, and yet they're in front of a camera talking to families, creating this Zooms with incredible accents with these puppets, and it's fantastic. It's great. It just adds to the atmosphere. So that was great. So I'm going to have to jump back way back into March now. As March 17th rolled out, we closed our center. And one of the things that I really wanted to focus on in terms of my job was to ensure that my staff were still hired and being paid. So there was a lot of work being done in the background, talking to our funders, understanding what their restrictions were going to be and what they're wanting to capture in terms of our stats, and then looking at our budgets to see if we can withstand the storm. And we've been able to. So we've been able to maintain all our staff, with the exception of our preschool, which we maintained them as long as we could until we weren't able to, because we closed the preschool. So we were fortunate that we were able to do that. Then my next step was, well, how are we connecting with families? We're doing all this stuff. We're doing the same things. We're doing the Facebook connections, the Zoom meetings, counseling online. But how do we capture that? How do we capture the impact? And through various conversations with the Facebook administrators, with Zoom administrators, and our website, we were able to get some real good data that's coming out of that. And we've just found out that we have 9 countries visiting our website. That's amazing. So we're really expanding our imprint. The other piece that I really wanted to ensure is that our staff are feeling safe and supported. It's one thing is to be in front of a family who's experiencing some challenges, but they're not your challenges. So you're helping this family go through this process, and then you go home to a safe place and not really forget about it, but really not put too much thought into it. However, COVID-19, when you're working with a family that is going through some challenges, you go home with the same challenge. So how can we support our staff? So we've done lots of things. We do Zoom meetings, we do wellness meetings, and I'm fortunate that I have two counselors on our staff that debrief with our staff on a regular basis. So that's good. So we've done that kind of stuff. I mean, the list is incredible, but really those are the biggest points that we wanted to take care of, making sure that their funders are going to still give us money, ensure that our staff are not laid off, ensure that our staff are supported, and ensure that our community is supported. We're launching a new program right now that is dealing with food security. That was one of the biggest issues in our community, and so we're partnering up with various agencies to ensure that the community gets fed, the children get fed. So we're happy about that, and we're also discovering that some families are experiencing a lot of abuse. So we're working with MCFD to see how we can connect some of those families that are experiencing that and providing some support around that. So those are sort of the things that we're sort of experiencing and dealing with. But really, that's it. I can talk forever.
Oh, thanks, Julio. I thought it was really interesting to hear how you're supporting your staff right now, and how you're beginning to think about what's next in terms of regrouping both, the staff, much like Sharon had mentioned, and also getting back to business. And you talked about leadership and how important that is, and how important it has been to empower your own staff to seize the day. And again, as we talked with Sharon, to give them license to think differently, to figure their way through this really difficult situation. And I guess this is one example of where it takes a village to think our way through this. And also, I was really interested in the data collection aspect. The data collection coming out of this period will be really interesting for all of us in terms of how we do our business in the future. And the fact that, you've noticed you have 9 countries that are reaching out and signing up is incredible in itself. We've noticed that on some of our webinars that we're getting people from all over the place, and thinking about how will things look and how will they function in the next few weeks and months, and what do we collectively have to do to kind of get back to business, but maybe business will be somewhat different.
I agree. I think it's going to be exciting. To be honest with you, I on the way over to work, I was listening to the radio and I heard, in fact, it was the Blue Jays president who was online there, and what he had said is that for the first time, it has forced him to reconnect with his children because he wouldn't have had that opportunity. So that's a wonderful story. That through this pandemic and some of the challenges that we're facing has really, in some cases, helped families get together. It has also had given us some incredible tools that we're going to continue to use, like the Zoom meetings if families are not here. So how can we connect with those who are at home because their child is sick? So these are wonderful things that have come through this process. And my staff are excited to continue to use some of these tools. So that's great.
Pretty interesting. Well, it's been interesting to hear how family serving organizations in, 2 different areas of Canada are adapting to this COVID situation. So many thanks to our 2 guests, Sharon Feldman, Supervisor of Family Resource Center of Jewish Family and Child Service of Greater Toronto, and Julio Bello, Executive Director of South Vancouver Family Place. for those of us who are in this business, managing through pandemic social distancing and isolation rules, it's pretty demanding. And it really does, as our guests have pointed out, require a lot of out-of-the-box thinking, some creativity, and above all else, dedication to the well-being of our struggling families. And you both have given us some serious things to ponder. So thank you both for joining us.
Thank you. Thanks for
Thank
having
you.
me.